Hello, I'm Dr. Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. You've been pregnant for 9 months and you are eagerly awaiting the arrival of your baby. What happens on the big day? We're going to talk about the stages of labor today. There are 4 stages of labor. There's the dilating stage, the pushing stage, the delivering the placenta stage, and the recovery stage. The first stage is the dilating stage. Your cervix is the lower part of their uterine segment, and over the course of your labor, it has to basically come back up into that lower uterine segment. It has to become large enough to accommodate the baby's head coming through. It has to dilate all the way from closed to 10 centimeters. 10 centimeters is about 4 inches. So when you're at home and you start to contract, your doctor's going to want you to be in good, hard labor before you come into the hospital, contracting every 2 to 3 minutes for at least 2 to 3 hours. You may break your bag of water, in which case, come on in. But if you're only contracting, stay home as long as you feel like you can. When you come into the hospital, your doctor or the nurse will evaluate you. There are 2 parts to the first stage of labor. The first is latent labor, and that can take hours and hours and hours. Your cervix dilates from closed to about 6 centimeters. Some people go through the latent phase very quickly, but again, for other people, it can take quite a long time of strong, active, hard contractions to get to that 6 centimeter phase. Now, what happens after that? You're in the active phase of labor, in which case the cervix dilates a little bit more consistently, 1, maybe 2 centimeters every 1 to 2 hours, between 6 and 10. Once you're 10 centimeters dilated, it's time to push. Sometimes, if the baby's head is still a bit high in the pelvis, your doctor may want you to wait and let the baby labor down. That's when your contractions are helping to push that baby's head down in the canal once you're completely dilated before you've started pushing. You're going to push with each contraction, and each time you push, you're generally going to push 3 times for 10 seconds each time. It can take between minutes to hours to push out a baby. The important thing is that every time you push, you're making a little bit more progress. A little more, a little more, a little more. Sometimes if you've had an epidural, the pushing process can take longer as well. You've pushed, the baby is out. Are you all done? You're not. The placenta's still there. The doctor has clamped and cut the umbilical cord. The baby is free. And now the placenta delivers. How does the doctor know it's time for the placenta to deliver? The cord lengthens a little bit. There may be a gush of blood from the placenta separating, and the uterus becomes more globular and starts to clamp down. The placenta delivers. The uterus gets massaged, and most likely some Pitocin will be administered to help the uterus clamp down and to stop the risk of postpartum hemorrhage. Now it's on to stage 4, the recovery stage. Most women will have some type of a tear, and or your doctor may have cut a small incision in your perineum, which is the bottom of your vagina, called an episiotomy, to help make room for the baby. That gets sewn up. We make sure that you're not bleeding. We make sure your blood pressure is stable, and you get to enjoy your baby. 4 stages of labor, generally 1 day, and you've gone from being a pregnant woman to a mother. Congratulations. This has been Dr. Lauren Hyman. Thanks for tuning in to Scooch Down.